Patient assessment, medical, psychiatric or behavioral. You have 15 minutes to complete this skill sheet. You are dispatched to a man out in the four-way stop, acting strange, yelling at people. Police are also en route.
All right, BSI is my scene safe.
Your scene is safe. Cops arrived. Have him in handcuffs.
All right, is this my only patient?
It is your only patient.
All right, I'm gonna consider mechanism of injury, nature of illness. Call for additional resources if needed. I will consider ceasefire precautions.
Okay, so your nature of illness, cop comes over to you, says that the guy was acting crazy out in the four-way, screaming, wasn't making any sense, tried to fight him. They wrestled him to the ground. They had to tase him.
Okay. So I'm gonna walk up. As I'm walking up, I'm make my general impression of the patient, how they appear. Is he still combative?
He's in handcuffs. He's kind of thrashing around a little bit. You don't notice anything super crazy.
All right.
He's laying left lateral recumbent. His skin's beet red.
Okay. Still yelling and stuff though. So right there, I'm looking at the airway and the kind of like where it's at, checking through my boxes there. If he's yelling, he's able to exchange air and protect his airway there.
Yep.
I'm going to consider my transport decision just based off of where we're at. I'm going to kind of stay and play there for a minute.
Okay.
Going to assess ABC, so airway, breathing, circulation.
Airways patent, like you said.
Okay.
He's breathing rapidly.
Okay.
Pulse is also rapid. Skin is very hot, non-diaphoretic.
Okay.
His pulse is regular.
All right. And then circulation, no bleeding or anything like that.
No major life threats that you've noticed at this time.
Okay. And the guy's yelling at me, so he's responsive somewhat there. As far as that goes, is he cognitive there? Is it making sense, or is he just yelling gibberish at me?
He's just yelling gibberish at you. He's not making any sense.
Okay. So I'm moving to some of my history taken here with law enforcement. There's nobody else there with him, so it's just law enforcement.
Yeah. The police say that they have multiple run-ins with him. They know this guy. They got a call saying that he was out there for at least 10 minutes yelling at cars. And they got there before you did, and it only took him about 10 minutes to wrestle him to the ground. He's not complaining of anything. And he is unable to answer your OPQRST.
Okay, so yeah, OPQRST, you got that. And so then from there, moving in, signs and symptoms. So erratic behavior, he's out in the heat, he's fighting with law enforcement, not making sense. Allergies, not gonna be able to confirm that. Medications, no real issue there. Some illicit drug use. Last oral intake, probably unknown. Law enforcement doesn't have any idea. And then events leading up to this, he's just in the intersection hanging out.
Yeah.
So sample history is going to be a little bit scarce there. From there, I'm going to kind of move into a secondary assessment. I'm going to start looking through a few different things there, like a 4-lead for cardiac side of things. Did I see anything?
Oh, yeah, he's sinus TAC at 130.
Okay. And then some neurological stuff. I'm going to check pupils, see if he has adequate responses, if he'll follow commands at all with certain things.
Yeah, he won't follow your commands. Tells you to get lost. His pupils are equal and reactive at 4 millimeters. No facial droop that you notice. Equal arm strength. No slurring of his words.
Things like that. So with that, I'm going to move into some of my vital taking stuff there too. I'm going to want to get an oxygen saturation reading on him. I want to see, we've got his pulse there, I guess. Blood pressure. With him being altered, I want a blood glucose.
Okay.
Let's see where his blood glucose is at.
So blood glucose is 88.
Okay.
Pulse oximeter is 98% on room air. Blood pressure was 190/120.
Okay.
Respiratory rate is 34, and it's rapid.
Okay. So rapid breathing, something we need to be aware of. It sounds like he's still oxygenating well and perfusing there. So my field impression of this guy is going to be that he's in some sort of delirium, excited delirium, just due to the nature of the skin temperature, him fighting, being combative, things like that. And so then my treatment plan for that would be for SED, just to simmer him down a hair there. I'm gonna give him 5 milligrams, and see what that does for effect. If his vitals will trend following that as he begins to calm down.
What's your route for your Versed?
I'm gonna go IV.
Okay.
And then hopefully IV goes well with him being in handcuffs. Can be difficult a time or two.
Your partner's dialed with feet IVs.
Okay, partner's got it. Partner's doing good here. So with that going on and the fact that we're starting to work towards something here, we want to get him moving. We're going to transport him down to the hospital and see what we can do there. And then as we're transporting him, we're just going to reevaluate.
Okay, he's Solomon now. You know, he's just taking his little snooze. You reassess. His skin's not as red as it was before.
Okay.
He is not unresponsive, but he's, chemically sedated.
Okay. Vital signs all look good though.
Yep, vital signs. His pulse has come down to 100. Respiratory rates come down to 22. Blood pressure is 140/90. Temp is still 99.
Good.
Anything else you'd like to know?
Not that I can think of right off the top of my head, but we'll just keep reevaluating, watching him every 5 minutes with his temp, maybe some passive cooling like the AC on in the back. Maybe don't bundle him up in a blanket. And then just make sure that as long as we're trending and we're following him and he's not decreasing or going too far where we'd have to support ventilations or anything like that.
All right, but you're ready for it. You're ready for it.
Yeah.
Love it. Anything else you'd like to add?
No.
Good job.